Hello and welcome to today's webinar discussion, which is on how are AI and IoT technologies changing our medical behavior. My name's Jeremy Cowan. I'm co-founder and editorial director of IoT Now, and I'm delighted to be your moderator today. Thank you for joining us around the world. I'm proud to say that this webinar is brought to you by our sponsors, China Mobile International, and we're supported today by independent analysis from Beecham Research, who are headquartered in the UK. Now, as you know, digital technology is being integrated more and more closely with health and medical care. One aim is to apply artificial intelligence, or AI, and the Internet of Things to the healthcare sector. In fact, it's fair to say this is becoming an essential part of life in the 21st century. After years of application developments and tests, today we're going to talk about how to use AI and the IoT efficiently to retain our daily health monitoring habits. These include wearables to process and act on patient information, to make medical treatment more effective and cheaper, and finally to make medical treatment safer and more accurate. So let's meet our distinguished panelists who are going to help us unravel all of this. They are, in order of appearance, Robin Duke-Woolley, CEO and founder of Beecham Research. It's really great to have your input, Robin.
Great, thanks very much, Jeremy. Good to be here.
Good to have you. And our keynote speaker today is Dinky Lin, Artificial Intelligence and IoT Specialist at China Mobile International UK Limited. She's responsible for consultation on end-to-end IoT and artificial intelligence solutions and services. And these are for various verticals, including intelligent buildings and smart cities domains, transportation, agriculture, and logistics. So it's a warm welcome to you too, Dinky.
Oh, thanks, Jeremy, and good to be here today too.
Well, thank you both. Now, don't forget, everybody, as always, this event is being recorded and you will be able to stream it tomorrow from iot-now.com. It's really important to us to find out what you're thinking. So in a moment, we'll be asking for your thoughts in our totally anonymous series of live polls. No one can see your individual answers, just the overall picture, and we'll bring you those results immediately. After all, we want to know what you think. It's really important to us. And then later on, after we've heard from all of our speakers, I'm going to be putting your questions to them. If you've already submitted a question, thank you. If not, you can start doing that right now. Send us your questions using the questions tab at the top right of your screen. If you haven't already found it, the top right of your screen shows an arrow to the left saying sidebar, and you can open up the polls section there and start to see the polls right now. So we're going to begin the process with the polling, and then we'll go to our speakers, and finally we'll come to your questions, which we hope you'll use the questions tab at the top right of your screen to submit to us. So you can start sending in questions right now, and we'll discuss as many as time allows. Any, of course, that we don't get to, we will pass to our speakers to answer offline later. Now, what I want to do is ask the audience to have a look at the polls. And the polls are showing here on your top right. They are, for example, what information would you personally want your wearable device to tell you? And you can specify up to 3 options maximum. That could include exercise information, medical information, dietary information, email communication history, social media updates, or something else. We can't specify on this platform, but you can click other if something else is your preferred. The next poll, and you can answer all of these right now, is what features of wearable technology are most important to you? Is it quality, price, innovative design, functionality, value, or visual appeal? So which of these is the most important one to you? Quality, price, design, functionality, value, or visual appeal? The next poll is, what are your biggest hesitations with regards to purchasing wearable technology? And here you can select up to 2 options. They can include price, or I don't think I'll actually use it, which is fair enough. One more device to carry or wear, that might be your choice, or lack of relevance or utility. You might say privacy is your biggest concern, or the size, or other. So these are the options. And finally, and really interestingly here, you're going to see the results of these, but the last poll is, have you used any connected medical devices in your own current or past projects? Is it very often, quite often? Yes, we've used it sometimes. Very few connected medical devices used, or none. So please start responding to those, and we look forward to seeing your results as you deliver them. But while we wait for those to appear, I'm going to go back to Robin and ask if you wouldn't mind taking the floor, Robin. The floor is yours.
That'd be great. Thank you very much, Jeremy. Okay, I'll get to my first slides. So first of all, I'd just like to remind you that there is an executive report that was sponsored by, or is sponsored by China Mobile International, written by myself and my colleague, coordinating patient healthcare with connected medical devices. All of you that have registered should receive that shortly. I don't think it's been sent out yet, but you'll receive that shortly. And some of what I'm going to say is within that paper, and some of it is not in that paper. So first of all, increases in medical demand, particularly those that would have an impact on connected healthcare. So healthcare around the world is subject to a lot of key challenges at the moment. We all know about COVID, of course. No need to dwell too much on that. Although I would say that in some of the interviews and surveys that we've done, about which I'll talk about shortly, it has highlighted COVID has highlighted weaknesses in healthcare systems, and perhaps trends, it's accelerated trends that were otherwise, coming more slowly, but have now had to be accelerated. But other key challenges are medical resources need to address high population demands, are often limited, particularly in rural areas. It's not uniform, as we all know. Of course, aging populations, with the proportion of inhabitants in many countries aged over 65 increasing substantially, requires more healthcare support. There are chronic diseases due to stress, living habits, obesity, and mental health are on the increase, also resulting in an increased demand for healthcare. And then there's mental health issues, which is very talked about at the moment, also increasing. More people are being diagnosed as suffering from depression, bipolar disorders, and or autism. That's, of course, particularly relevant to the lockdowns that we've all experienced recently. And then illnesses caused by environmental factors and other concerns. So things like air pollution and illnesses such as strokes, ischemic heart disease, and lung cancer. So there's an increasing demand on medical resources at the moment. And that's only going to increase over time with all of those. So addressing that, certainly connected healthcare can have a real impact on that, and that's of course what we're talking about in this session, associated with artificial intelligence. This is a diagram that it's a little small for you to see in detail, but these are some of the factors that are driving the mainstream adoption of connected health. And they really come in four groups. There's the technology aspects, so the need for data management and analytics, specialized sensors and devices. So all of the technology developments that have been coming over the last few years. There's the market players and what they need to get out of it. So that ranges from hospitals and clinics, insurance and finance, IT infrastructure, and so forth. So there's a lot of different players involved in connected healthcare. Then there's the economy and environment. So there we're talking about things that I've just mentioned, for example, aging population, chronic disease, and those sorts of demands. And the demand for hospital beds is increasing. The pressure on health and social care, all of those requirements. And then there's regulatory and policy requirements. So things like public confidence, government health policy, secure health records and certifications and stuff like that. So there's a lot of different strands leading towards connected healthcare. And you'll see this in the executive report. We divide connected healthcare into 6 key segments, which really represent the journey that a patient can go through in being treated by the healthcare system. So there's in-hospital stay, there's care home, nursing home, there's at-home chronic illness care, there's GPs and other surgeries, pharma and life sciences research, I'll come back to that. And then there's ambulance and emergency rooms. So you can trace through where a patient will be. Probably the one that's not related quite to that journey is pharma and life sciences research, which tends to be like new vaccines and development of clinical trials and things like that, which are all need to be connected to get quick results. But yeah, through all of this, there is an opportunity to connect up and therefore get a consistent view as to what's happening to a particular patient through their journey through the healthcare system. And that provides opportunities for reduced time needed for correct diagnosis, accurate identification of treatment, cost reduction, efficiency improvements to all parties, and faster development of new medicines and vaccines. So that's a snapshot, if you like. And in the report that I mentioned, there's more detail on those to catch up with some of the detail relating to those. I'd like to then this is skipped ahead a bit. I'd like to focus out from that core picture in the last diagram, which is right at the center of this bigger diagram. This shows the connected healthcare application areas. Again, we've used the 6 areas that I mentioned just now, but then moving out to the outside. What I've done on the right-hand side is take a piece out of what's on the left-hand side, the in-hospital stay, and enlarge that so that it's possible to actually see what's written in that very small writing. There is, in fact, an opportunity to get hold of this chart at the URL below, connectedmedicaldevices.com. But what this shows is that at the outer edge for in-hospital stay, there are a very large number of different IoT applications that can have a bearing on what happens in hospital. So can be related to connected healthcare. So we've got X-ray scanners, connected ventilators, bed occupancy sensors, and so forth. And of course, we've got lots of robots and artificial intelligence as well. So, you know, in addition then to the journey through the healthcare system, in each of these segments, we've also got much greater depth of dealing with and monitoring particular conditions, and a lot of development in individual application areas that are increasingly associated with IoT. So we've got a sort of breadth and depth going on in connected healthcare. So if we then move on to some pointers on the use of IoT in key healthcare areas. So for example, a smart hospital is an advanced facility where everything is tracked and managed simultaneously while all data is collected in a centralized database. That's increasingly happening, and I think Dinky will be saying a little bit more about that. 1 in 7 in the world are estimated to be living with disabilities. Now, that's always been the case. There's always been a lot of disabilities, but there's much more opportunity now to actually support that than there has been before with newer technologies. The IoT network itself can connect and track practically any sensor inserted into a human body for medical purposes. Yes, you might think that's good. You might think that's not so good, but nevertheless, that's practically what's actually possible. Interestingly, a US survey found that close to 60% of physicians have some reservations about the quality of care they can provide remotely. And that's down to not having the equipment to deal with things remotely. So there is a strong need, perhaps, to have more remote diagnosis and management capability. So, and then a further observation, IoT can help transform the ambulance into a remote consulting room. It can be much more intelligent right at the point of need, for example, in an accident. So there's all sorts of areas where IoT can move things forward from the traditional base. And then we've been conducting quite a lot of interviews with healthcare professionals, and I'll talk in a second or two about a survey that we've done. But some observations from these interviews. So these are like snapshots, quotes, which are quite interesting to get sort of a feel for what people are thinking. Well, the first one, it takes at least 1 year to realize the benefits of a data analytics project in healthcare. There's a lot of effort needs to go into actually getting data analytics working properly. For success, it is necessary to identify the best data and its many sources and establish confidence in the data, then craft applications and dashboards to offer practitioners meaningful and actionable information. It doesn't come together immediately. It needs a lot of careful work to make sure that it happens. You know, we could say that everything in healthcare is complicated, including the use of IoT relating to it. The second one is the most often identified challenge was the huge disparity and dispersion of data that needs to be collated and analyzed for clinical understanding. Much of the legacy information on patients is stored in the form of unstructured data which cannot be read and analyzed by machines. Some hospitals lack readiness in terms of the infrastructure needed to support large-scale dispersed data collection. There is also a general distrust of new analytical tools and techniques, and of course cybersecurity is a major worry with reports of hospitals' data being hacked. So yeah, identifying some concerns there as well as some opportunities. The next one, the healthcare profession also relies on the pharmaceutical industry to supply new drugs, but interactions between the two disciplines has been negatively affected by the virus pandemic. And we can see why that would be the case. The real need for communication between the different parties in healthcare systems. And then the last one, in the US, telehealth is starting to become reimbursable, which should greatly increase adoption. So it's becoming part of the financial infrastructure, if you like. So then much more chance of it being implemented and moving forward and becoming part of the general structure. So this is my last slide, which is a very swift extract from a survey that we conducted among healthcare professionals. Areas where connected healthcare projects are currently being implemented. Perhaps you'd expect telehealth to be top, but certainly it is. A lot going on in telehealth areas, but a lot going on also in hospital. And then specialized in hospital would be specialist units, specialist departments within hospitals as opposed to general in hospital. And then temporary new facilities, pop-up areas. For example, in the current pandemic, we've had pop-up hospitals and they always have to be fully equipped, of course. And then emergency medical services, we'd all be familiar with that. And then other sort of clinical labs, long-term care, instructional, and EMT services. So it's interesting to see where those activities are happening, as I say, particularly telehealth, but also substantially high is in hospital. And then the types of devices being connected. Now, stationary devices has always been where healthcare has been. And although that continues, it's interesting to see that there is much more of a move towards movable and even handheld. So handheld, I would say, is increasing quite quickly, and that reflects some of the stuff that's going on in wearables, which is part of the polling that is being done right now. So that's interesting, but also movable assets, both inside hospitals and then beyond hospitals as well. So there's a lot going on in healthcare to connect things up. At this point, I'm going to hand over to Dinky, who is going to move us on to what China Mobile is doing to address these areas, in particular for artificial intelligence. Over to you, Dinky.
Hi, thanks. Thank you very much, Robin. Hello, everyone there. First of all, I would like to thank you all, for joining us today. And like Jeremy has introduced in the very beginning, my name is Dinky, and I work as the IoT specialist here at China Mobile International UK. Right. Okay. Since our main topic today is to talk about how AI and IoT are changing our medical behavior. So I will start with the current AI and IoT developments in healthcare industry. And following by that, let's have a look together at some application scenarios which our company has deployed in China and some Asian countries. Right. So let me turn on to next page. Right. Okay, so first of all, I have categorized these developments, I would say, like into three areas, all right? The first one is about personal health management, which is to personalize health services in order to transform from medical treatment to illness or disease prevention. So what I mean by transformation from treatments to prevention is how we individuals can manage and monitor our personal health conditions every day, all right, by using those wearables or any portable devices at home. Next one is about cross collaboration, which is about how those health-related data are synchronized, okay, between like GPs or family doctors and community hospitals and even national or city hospitals. For example, if someone involved in a car accident, all right, and has been sent to a city hospital, the emergency room, okay, in a hospital can quickly find out this person's health history in the system if all the health information is synchronized with the local doctors, family doctors, or the local GPs. That's gonna help a lot and speed up the the rescue. And the third main, I would say, key development is hospital digitalization. I would say that this covers very, very broad range, I have to say. It can start with the registration system, and then let's say the pharmacy management system, doctor or nurse station, management system, health record filing system, and even the whole IT communication systems within the hospital. Later on, I will share with you the application scenarios on smart hospital or digital hospital, we call it, so you can have a better idea. Now, I would say that you must have heard about people saying, oh, digital healthcare. But do you have a picture of how this digital healthcare architecture is like? Right, let me show you quickly. Yeah, here it is. I would say this slide here explains most of the digital healthcare solutions you see in the market. Right. Basically, the whole infrastructure should include, I would say, like 4 different layers, which includes like devices or equipment, and network connectivity, cloud platform, and the software applications. All right. Here, have a look at the device layer first in the bottom here. You might be wondering, hey, Dinky, why did you put down security hardware devices? We are talking about healthcare, isn't it? We are not talking about CCTV or access control, etc. But think about it, yeah. Have you seen all those all these security devices in the hospital? For example, like smoke detectors. I'm sure that there are so many smoke detectors everywhere inside the hospitals, even in our, let's say, local GPs or family doctors, or even at our, sweet home. Now, like, for example, like trackers, you also might be wondering, why trackers? It sounds unbelievable, right? But also, like, think about it. If it is within a care home, or if you live with your grandparents, for example, who have chronic disease or Alzheimer's disease, or even like with disability, yeah, will a tracker, with a panic button, help to ensure you or the carers can find them, when they get lost, for example. I hope this makes sense here, right? And obviously, this device there also include all kinds of health monitoring devices or wearables, and even some network products. The next there is about network connectivity, right? Internet of Things. We all talk about like IoT, which means all those things or devices we have just talked about, yeah, are connected to the internet. So network connectivity is definitely a key element in digitalization, isn't it? And this network connectivity can include all types of cellular network, okay? No matter it's 2G, 4G, or like 5G. People are talking about 5G these days, and even like NB-IoT network in Europe, and even a private network, especially for hospitals scenario. Therefore, oh, by the way, I understand that the cybersecurity is the #1 concern in a hospital, all right, and therefore, like lots of hospitals own their private networks, like our company, China Mobile. We have partnered with Nokia, we have partnered with Cisco, and even like Vodafone here in Europe to deliver both wired and wireless private network for our customers, enterprise customers outside China. Right. Next layer, I'll say, is the most important part of the whole solution, to be honest, which is the cloud platform. And what this platform does is like a CPU in a computer, or you can say it's like a heart, in our body. And this can also, this platform can also work as you also can call it like a data pool as well, to provide many different cloud services, features, capabilities to digest data, to analyze the data, to compute the data coming from all types of hardware devices. And those capabilities include, for example, like real-time tracking, the device locations, making emergency calls when a panic button is triggered, for example. And in terms of health data platform, here, you also provide analytics engine function and device management capability too. Now, the final layer, okay, on the top is the software application, which include applications for consumers like you and me. You know, application solutions for enterprises or businesses like care homes or nursing institutions, and also for governments as well. For consumers, very easy and straightforward example. We all use mobile applications to control our smart devices, isn't it? And the mobile app is the software application for consumers and for doctors working in hospital, for example. They also use their own mobile applications for mobile access to any resource, any medical resource within hospitals. In terms of enterprise application, this can be used in care homes or private hospitals. All right, and when this comes to government level, I would say, you know, it would include broader, very broad applications such as like smart hospital application, telemedicine application solutions, etc. Now we have finished the architecture. Now, you know, let's find out more about those applications. Right. I would like to share 4 application scenarios which we have deployed in APAC region. Home-based application, integrated healthcare and nursing applications, telemedicine application, and smart hospital. Right. And let's have a look at the home-based application. Obviously, it's all about, you know, all kinds of hardware devices you and I can use at home, because this is home-based, right? Including all those like smart home devices and health monitoring devices. Let's say, as an individual like you and me, if we have one single mobile app which can be used to monitor, let's say, our home environment, as well as like to record our daily health conditions. I would say like it would be very, very great, isn't it? And think about a scenario. If you live with your parents or any other family members who might have, you know, again, like chronic diseases, or and most of the time they need to stay at home alone when you are away from work. How can you ensure that your loved ones, you know, keep safe alone at home? So that's why, you know, we are trying to link or to combine these 2 sectors of home management and health management into one place. And remember, this home-based, you know, this application can actually achieve what I have mentioned in the very beginning: transformation from treatments to prevention. Right. I hope it makes sense to all of you here today. Okay. And the next slide here is just to show you the benefits of using home-based applications. Okay, this doesn't, you know, just benefit to our individuals, but also the whole family, the whole community, and the whole country. I'm not going to go through, you know, a lot of wordings here. I'm not going to go through, you know, all the details. But if you're interested to find out more, you can download this, you know, this file after the events, after the webinar. Right. Okay. The next application scenario I would like to share with you is integrated healthcare and nursing solutions or applications. We really have to admit that, you know, this society we live in nowadays is an aging society, and private home care for elderly, you know, is a growing concern for our next generations, right? Lots of digital healthcare solutions we have seen in the markets aims to provide medical services to the elderly in their homes, in care homes or nursing, you know, institutions, and even in hospitals. While the upcoming 5G technology, remotely monitoring elderly people, right, within their homes is now achievable, and basic care, data collection, guidance, as well as the diagnosis can be offered by medical professionals, no matter where locations are. Let's take the common way you and I usually do to manage our health as an example, right? They say traditionally, you know, I might have a regular health checkup with your local GP or hospitals, such as like once a year or even like once every few years, right? This has the risk that we might not be able to test out the disease timely and accurately, as this is really a long time span. It even might result in costly treatments and surgeries and even like hospitalization fees. Okay, with today's technology, we are able to embed this checkup into our daily lives, okay, in order to provide like long-time dynamic health condition analysis and with integrated healthcare and nursing solution, okay. All those daily checkup results and data can be kept and uploaded remotely to our local GPs or family doctors or like community hospitals. And this is definitely helping, you know, disease diagnosis in a timely way if something goes wrong. And through such, you know, daily checkup with pre-alerts or warning messages, you know, this can also avoid emergency and even critical conditions for chronic patients. And this is what we expected to improve and maintain our health quality as a goal. Another benefit of this, I would say, like digital healthcare solution is to help patients to maintain their self-care lives, prevent disease, and greatly reduce their medical costs. Okay, as well as like saving and reducing medical resources in general. So to sum up, okay, I'll say that based on the IoT sensor capability, it connects services and resources across home, community, and connected hospitals, you know, in order to create a 3-in-1 platform. All right, I'm sure that you must have heard people talking about how 5G is important to improve digital healthcare. And we also have to admit that, you know, with the support of 5G technology, the functions of smart software and hardware products, you know, will be further extended, enabling like in-depth mining of medical data, so it is to make better decisions and allocate, you know, medical resources rationally. Okay. In addition, the combination of 5G and big data can also realize the flexible interaction of information among like doctors, patients, and various departments of the hospital. And also like more wireless smart devices will form a complete system too. And doctors can also collect and accumulate, you know, medical data in the system, break the time and space constraints, and also achieve continuous and accurate detection and inspection. Right, and also like, for example, like in the emergency work that is racing against time, right? The 5G millisecond level low latency advantage also can better ensure that the hospital is ready to receive patients quickly and enter the rescue, you know, after they arrive at the hospital. So I would say that with the support of 5G technology, the digital healthcare system will make full use of information technology such as like Internet of Things we are talking about, big data, artificial intelligence, cloud computing, etc., right, to enhance patients' medical experience, promote the syncing of high quality medical resources, and improve the effectiveness of medical services. So I'm sure that this is definitely going to speed up the 5G deployments in many countries. All right. Okay, so the third application scenario I would like to share with you is telemedicine, which will include like remote consultation, remote outpatient services, remote ultrasound, and remote surgery as well. Right. In terms of remote consultation, in many countries, you know, it is difficult for residents in rural or remote areas to access efficient and high quality healthcare services. And traditional tele consultation used wired connections or for video communications, resulting in high construction and maintenance costs and poor mobility as well. So here again, with the 5G high-speed network, which supports like 4K, even like 8K remote high-definition consultation, I would say, and high-speed transmission and sharing of medical image data, those doctors or professionals can conduct a consultation anytime and anywhere, improving the diagnosis, accuracy, and guidance efficiency, and promoting close to patients deployment of high-quality medical resources. The next one is remote outpatient. Okay, remote outpatient is a new service that allows patients to receive medical services remotely, obviously from experts or doctors in community hospitals through communication and multimedia technologies. And nowadays, with the high-speed network connectivities, it enables HD audio and audio interaction and high-speed transmission of medical image data, allowing experts to provide optimal real-time diagnosis, examination, treatments, and consultation services to patients anytime, improving the outpatient service quality of community medical institutions. Right. Remote ultrasound, okay, quickly to go through. I believe that probably we're going to run out of time very quickly, right? Compared with CT and MR, yeah, ultrasound examination require, manual operation by qualified doctors. And in many countries, especially like in China and some Asian countries too, I believe that this is still a large shortage of ultrasound doctors. So I would say, therefore, it is difficult for community hospitals to carry out ultrasound examinations. However, nowadays, those experts, they can now remotely control the robot arms to perform real-time ultrasound examinations on patients in hospitals. And if there's 5G network available, obviously, as this can be achieved through the millisecond latency of 5G. Right, I'll move on quickly to the remote surgery. Right, the doctors now can perform remote surgeries on patients in community hospitals are using medical robots and high definition audio and video interaction systems. And experts also have full control over the surgery and patient status, while also providing care for surgical operations and guidance over a physical distance. And again, this technology can significantly reduce medical treatment time and cost, and facilitate access to high quality medical resources for sure. Okay, the fourth application scenario I would like to share today is the hospital management, which includes smart hospital, medical cloud, and mobile healthcare, real-time patient monitoring, hospital security management, and full life cycle management of medical equipment are paramount in smart hospital construction. I've been talking about 5G many times today. 5G network or other low latency network are really critical to ensuring that medical and non-medical equipment and services are interconnected to provide services such as like hospital asset management, first aid scheduling, personnel management, equipment status management, access control, and even like hospital navigation and a lot more. Since I think we are running out of time, but just let you know that medical image cloud can also be, a very sensitive topic. However, we are not talking about cybersecurity, so we just want to focus on how the market situation is like. But before, because again, since we are running out of time, so maybe I can spend 30 seconds to talk about this. This very important part, which is the mobile healthcare, right? Mobile healthcare, extends the diagnosis and treatments to patients' bed. Through the high-speed network connectivities, doctors and nurses can collect data now regarding patients' vitals and over bedside mobile high definition consultation. Okay, greatly in improving the quality and efficiency of work rounds. In sensitive work rounds such as like radiology or even like the epidemic zones, the medical personnel can attend to patients, through robots or AI technologies, ensuring the safety of medical personnel. Right. Okay. That's all for my part. Probably I've been talking too much, and I hope that I didn't bore you all. And now I will pass it over to Jeremy then. Okay. Thank you.
Thank you, Dinky. Nothing boring about that at all. It's fascinating. Time is short. You're right. We will need to press on. So I won't go back to review the poll results. Anybody who has answered the polls will be able to see their results there. But we do have a lot of questions, and they're really good. So let's get straight to them. First question is for you, Robin, actually. The questioner Remy says, can you comment about those hospitals which have consolidated data into a single database? Can you give an example? Because Remy's never come across any of those yet, but it sounds exciting. If to maximize the number of questions we can do, could you keep it to a minute in your reply, please?
Yeah, there aren't that many, I have to say. It's more like an aspiration than an actual achievement. And part of the problem is is bringing together data from different sources, which is all in different formats. So you tend to get localized bringing together rather than centralized. But then there's a need for those dispersed centers, if you like, to communicate so that you can get an overall patient record. So I think it's there are some healthcare systems where it's been achieved more than others. Some in Europe, in particular, and a few in North America. In the survey that we conducted, the success rate of actually achieving that was quite low, but the aspiration was very high. So
okay, well, fair enough.
Yeah.
I think that speaks volumes. Obviously, it's easier to say than to do. Good question here from Paolo. I'm going to put this to you, Dinky. Paolo wants to know, what do you think is the most valuable aspect of AI for healthcare? Is it fast diagnosis, disease condition prediction, or something else? And he asks, is IoT applicability limited to health parameters measurement and storing and transmission for later analysis? Big question there. A lot to answer in a minute, but can you try?
I will try my best, okay?
Thank you.
But I know that because I normally talk too much, but I'll try my best to reduce here. All right. To be honest with you, I am not an AI expert. Okay, IoT I'm okay, but there's one technology I would like to mention, which is digital twin. All right, because digital twin technology has been used in many, I would say like quite a few application scenarios. Okay, for example, like smart cities or industrial IoT 4.0. And I also have done, actually, I saw quite a lot of research. Okay, it seems that a lot of like development institutions or enterprises are now using this digital twin technology in healthcare or medical care developments. What this means is that in the future, we will be able to see a simulated version of ourselves, okay, which are to predict. I'll say that is to predict if we would have any risks of getting illness or any kinds of disease. So I believe that this is another interesting topic. So when we talk about AI, I believe that is more about prediction.
Well, it sounds as though we could have a whole different webinar on AI, but we don't have time for that. We'll come back to that another day. I'm going to come to you, Robin, first and ask you to do me a 30-second answer on this for Anne. She's asking, or she's quite interestingly stating that old people are digitally illiterate, and for them to use healthcare connected problems at home should be extremely easy to use, and therefore sending data through one very clear button to their general practitioner or specialist at the hospital. It's not exactly a question, but would you agree with that? Do you accept that? Do you think that is a fair assessment?
Not entirely. I mean, I think that it's fair to say that older people have less understanding typically of newer technologies, but it's not universal by any stretch of the imagination. I mean, she probably wouldn't want me to say so, but my 99-year-old aunt spends all of her time on the internet, and she's got an iPad, and that's what she uses. So
why not?
It's not universal that older people are technically or digitally illiterate, but
No.
there are an awful lot of younger people who are illiterate digitally as well. So certainly making it easy to use is very important. But then it is for smartphones as well, anyway.
I think ease of use is such a crucial thing. Sometimes it's not a digital illiteracy, it's just simply, is this hard to see? But great question here from Amaka. I'm going to ask you, Dinky, this one. How do we incentivize various stakeholders to share data safely? And are there policies encouraging this approach? Can you do me 30 seconds on that to help Amaka?
All right, this is definitely a very, very good question. But if you don't mind, like if I carry this question offline, I can get back to the.
Fair enough. It is a huge question, and one that probably deserves far more time than I was going to give you. The next question that I wanted to put is from Christophe. He's saying increasing demand in medical is mostly driven by the increased interest of patients. He sort of felt that part was lacking in your slide, Robin. Would you agree? Is that something that needs to be refreshed in the next research? Do you think that the increased interest amongst patients in medical is driving this sector?
Well, I think it's a very interesting point, actually, because I think that there is much more literacy among patients about medical conditions now, and what can work, and their own diagnosis and things like that. And we get much more information online, for example. So Dr. Google is very useful sometimes. So I think that there is much more acceptance among people generally about what's going on. I wouldn't put it as a major trend, though. I think that the trends are much more overall, like the fact that we've got aging populations, and like we've got greater mental health issues and stuff like that, which I think are the other conditions, if you like. But the enablers do include certainly greater patient literacy in conditions. So I would say it's an enabler of greater speed than anything else.
Fair enough. Question for you, Dinky. We've probably got a couple of minutes left, so a couple of questions to go. Anne is asking, I believe households should have a cheap or cheaper solution for a defibrillator, as most of the time defibrillators are, to be fair, too far away to help a person within the required 6 minutes. What options can you think of besides defibrillators? Dinky, I don't hear you. We seem to have lost your audio.
She's on mute.
Dinky,
Yeah,
that's okay. Did you hear the question?
Yeah, I heard the question, but I'm sorry, Jeremy, because I didn't really quite understand that word. What's that?
I think it's for heart defibrillators to restart a stopped heart. I believe households, says Anne, should have a cheaper solution for defibrillators because they're often too far away. And she wanted to know if there are any other options that households should have.
I believe so, but for this part, that if she's interested, like she can keep in touch with me offline, and then I can provide her like quite a few, like alternatives, solutions to that, if that's okay.
Robin, a question here for you from Irvin. He says, since we're affected by COVID-19, especially at the hospital, is it good to use AI to detect the person if they have or haven't a case of COVID?
Well, if it's possible. I think so. A lot of AI is it's coming, and it's coming quite quickly. It requires a learning process, and some of that can be done in modules and slotted in, and that's what will get us to very large volumes of AI, particularly at the edge of the network, more quickly. So if there is AI available that can look at COVID issues, if you like, and help to diagnose COVID, then yes, absolutely perfect. But I'm not sure we're quite there yet. No. To be honest, I think that there is more research required before we actually get to that.
I've got a 30-second. I've got a 30-second opportunity for Dinky, if you are able to answer this one. Aska is asking, how about the cost or benefits for the hospital if the technologies are applied for digital healthcare? Because, as he says, as we know, hospital is a business, and business is talking about money or profit. Can you keep your answer to 30 seconds? Otherwise, I'm going to get into trouble.
Right, no problem. You know, like in terms of this kind of digital healthcare solutions nowadays, you know, we know about like most of hospitals, they probably prefer to do the let's say the OPEX model, not the CAPEX model. So you know, a lot of like applications, you know, we can do is tend to be the OPEX model for let's say for the healthcare industry. So this is, I would say, this is the commercial trend in the market nowadays. Yeah.
That's very fair, and thank you for confining your answer on a big question to such a little time. It's been fantastic. I can't thank the audience enough for these questions. They're still coming in. There's so many good ones. What we're going to do is pass them straight over to our speakers, and they, I'm sure, will want to take up their answers with you offline afterwards. But as always, we are out of time. We've covered a lot of ground looking at connected medical technology. I'd love to carry on longer, but I'm going to get my knuckles wrapped if we go too far. So I'm going to have to call a halt there. Don't forget, please, to bookmark our website at iot-now.com. And from tomorrow, you can stream this entire discussion there. It just remains for me to say a really big thank you. A thank you to our speakers, Dinky Lin from China Mobile International. Thank you very much, Dinky.
Thank you, Jeremy, and thank you, Robin, as well.
Yes, thank you too to Robin Duke-Woolley from Beecham Research. We do appreciate your input, Robin.
Great, thanks very much, Jeremy. Good to be here.
And most of all, ladies and gentlemen around the world, we want to thank you for joining us wherever you are. Until the next time, we really look forward to seeing you again. Bye for now.